What is cerebrospinal fluid in TB meningitis? Imagine a clear, protective cushion surrounding your brain and spinal cord. That's what cerebrospinal fluid is. In tuberculosis meningitis, this fluid becomes a battleground for infection and inflammation caused by the bacteria Mycobacterium tuberculosis. When tuberculosis spreads to the membranes covering the brain and spinal cord, it triggers a severe inflammatory response that changes the properties of this fluid. In TB meningitis, the cerebrospinal fluid usually shows some characteristic signs. There is often an increase in white blood cells, which are part of the immune system trying to fight the infection. At first, there may be more neutrophils, a type of white blood cell that responds quickly to bacterial infections. As the disease progresses, lymphocytes, another type of white blood cell involved in immune defense, become more prominent. This shift helps doctors understand the stage of the infection. The protein level in the cerebrospinal fluid also rises because the blood-brain barrier becomes more permeable. This barrier normally keeps the brain protected, but inflammation causes it to become leaky, allowing proteins to escape into the fluid. At the same time, glucose levels in the cerebrospinal fluid tend to drop. This happens because the bacteria and immune cells consume glucose, and inflammation hampers the transport of glucose from the blood into the fluid. The appearance of the cerebrospinal fluid can vary. It might look clear or slightly cloudy, depending on how advanced the infection is. Sometimes, doctors measure other markers, like enzymes such as matrix metalloproteinase 9, which increase during inflammation and can indicate blood-brain barrier damage. Immune mediators and cytokines, which are signaling molecules of the immune system, are also elevated, showing active immune responses within the central nervous system. Since direct access to brain tissue is not possible, analyzing cerebrospinal fluid through a procedure called lumbar puncture is vital. This test helps identify the infection, assess how severe it is, and guide treatment decisions. However, diagnosing TB meningitis can be tricky because its symptoms develop gradually and can resemble other types of meningitis. In summary, the cerebrospinal fluid in TB meningitis is a key indicator of infection and inflammation. It shows increased white blood cells, higher protein levels, lower glucose, and signs of immune activity. These changes help doctors diagnose the disease, monitor its progress, and decide on the best treatment options. If you suspect TB meningitis, it's essential to consult healthcare professionals for proper testing and care.